Okay, this video is about back pain. It's the one that I don't want to make because I just don't like talking about this issue, but it's the one that is kind of the elephant in the room that needs to be talked about. Otherwise, I won't be able to do anything else. But basically, say back pain or almost any other pain for that matter. The science in the past 20 years that has come out has completely changed our understanding of how pain works, what it is, and what it's about. But what hasn't happened is the pivoting within our systems, our medical system in particular. Our pivoting hasn't changed, or hasn't we haven't pivoted even with in the midst of really good information. So that's what I want to address today, because I think one, that it's unethical to not pivot, even though we see what needs to happen. We need to be proponents of change. And two, it's unethical because we took that Hippocratic oath of first do no harm. And then three, it's not helpful for the people who are in pain. It's just like they become the target rather than the target that receives maybe even more pain than they should, and they should be the ones that we are actually we shouldn't look at them as we shouldn't look at people with symptoms as money makers, right? As our bankroll. Yeah, I understand that money needs to move, but not at the expense of people, especially when it's unethical. So what are we looking at here? Again, we're looking at a system. We're looking at a system of institutions, basically colleges and universities that put together these curriculums so that people can receive a degree and then take the boards, get licensed, all of that. So some of those people, maybe doctors, come out of their schooling with, say, $200,000, being $200,000 in debt. That's a hard one to pay off right away, especially when people have a standard of living to maintain. So already their ship is sinking. But what happens to a person who is going through pain? What might that journey look like? Right? Let's describe that and put numbers to it at the end. They go to their doctor. Okay, they go to their doctor, try to get a diagnosis, try to understand what's going on. Maybe they receive some sort of shot or some sort of medicine, and that's maybe their first visit. After that, maybe usually those things either wear off or didn't work, so they go back. Maybe doctor tells them that they need X-rays, MRIs, some visual proof. Maybe X-rays are covered by some insurances, maybe not. Maybe similar with MRIs. If not, let's just take that since it's a cash. Since we want to look at numbers, for an X-ray it might cost $271. For an MRI, maybe $461. So that's a lot of money right out the pocket. Especially if you get those results, but still don't have any good treatment recommendations. Maybe a person gets, a cortisone shot, something like that. Okay, again, cortisone shot, that's got limited relief, but it also can subject us to some tissue damage, like damage in the cartilage or joint infections, or it might weaken tendons. There might be some nerve damage that comes from it, right? These things just may come up, not of any fault of the doctor, but these things just happen, right? So an average cost of, steroid, or maybe a round of them, would be $778. So you could already see that they're up to maybe $1,000 out of pocket. Let's look at two surgeries that people often get. One is less invasive, which is called a laminectomy. With insurance, that might be, $200 to $2,000 after a deductible, after that's paid, and a cost without insurance might be from $50,000 to $90,000. A spinal fusion cost with insurance is the same, maybe about $200 to $2,000 after the deductible, but a cost without insurance maybe $80,000 to $150,000. And then other costs that a person doesn't think of are the back brace, the PT. Back brace might cost $50, PT might cost $1,000, meds maybe $50. These are all arbitrary numbers just to put something together, give us a sense of the journey and the process that people go through, right? Laminectomy might cost $72,000, say. That's a lot of money. And the thing about that is, they're not all 100%, right? So this is our main issue, is that we're going off old knowledge, and we're seeing a lot of data that points that things need to go in another direction. But these things are still happening today. We didn't factor in recovery time, which might take 4 to 6 weeks. Is this person going to be out of work? Who knows? Now let's go into an article that I read recently from the U.S. News and World Report. We're gonna just skip to the very end, but I will summarize the beginning. Basically, the beginning was a number of paragraphs, really qualifying this whole thing around back surgeries. But the beginning is like a typical article where it just kind of gives numbers, statistics, and facts about back pain. So this many people in the world get back pain every year. For this many people, it goes away. For this many people, it stays, and they have to actually get treatment, right? Skip down to the very bottom of all that. And in bold, the headline says, back surgery can provide relief in extreme cases. So, okay, cool. They still qualified what they do, back surgery, right? Can provide relief. And then extreme cases isn't defined. What does that even mean? So people might be going and saying, well, I saw my doctor. I have this herniated disc. I'm still in pain. This must be an extreme case, and I should probably get surgery. But if they just read the next line down, it says, if you're experiencing back pain, it's generally recommended that you exhaust non-surgical or more conservative treatment options before considering back surgery. Okay, then it goes into a quote. Dr. Ray Ostery, an orthopedic spine surgeon at California Pacific Medical Center, said in a recent article that surgical methods have advanced tremendously in their ability to solve back problems in a minimally invasive way. So he's, again, qualifying and almost putting out there that, yeah, this is all advanced and to solve some back problems, right? Solving them, that's a word that gives us 100% almost, resolution, that's probably the way to go. Then the next sentence, the last sentence says, after that whole article where, using up all these brain calories to get us to this last point, right? However, studies show that when it comes to back pain alone without other symptoms, surgery doesn't work any better than rehabilitation. So, okay, you went through all that just to let me know that I need to exhaust all my other non-invasive resources. Just tell me that from the beginning. So anyways, that's basically what happened. So we need to update not only our information, but all of our systems. And we need to update the public. People should know about this. So in other videos, we'll go into the myths about pain, and hopefully that helps define it and clarify it for you. But certainly we need to learn more about pain, because without learning about it, we can go down a track that I've personally seen many people go down, and they weren't happy. People come into my office crying, and then people leave actually saying, wow, I feel better, and this has given me hope. So, this is the video that I didn't want to put out, but it is what it is. Here we are. I feel a weight off my chest. Let's get rolling.